Hello friends, have you read recently in any newspaper about Guillain-Barré syndrome outbreak in India? Yes, it is true. In many newspaper it is quoted that there is outbreak in Pune, Maharashtra. Guillain-Barré syndrome is a rare neurological disease known as GBS has been spreading across India with the first fatality confirmed in Pune. Health officials are investigating the cause of outbreak which has seen over 100 cases reported in Maharashtra alone. So today we will talk about Guillain-Barré syndrome in details. I am Dr. Arun Kumar. Let's begin with the introduction. Guillain-Barré syndrome is a rare and potentially life-threatening neurological disorder in which the body immune system erroneously attacks the peripheral nervous system. The condition can affect individuals of all ages, but it is more commonly observed in adults and males. Guillain-Barré syndrome is often preceded by an infectious illness, such as respiratory or gastrointestinal infection. The syndrome can occur after viral infection like influenza, Epstein-Barr virus, Zika virus, or bacterial infections such as Campylobacter jejuni. Additionally, Guillain-Barré syndrome has been reported following vaccination or surgery. Though these occurrences are less common, the hallmark of Guillain-Barré syndrome is the rapid onset of muscle weakness and paralysis, which typically start in the lower limbs and ascends upward. This can progress over hours, days, or weeks, leading to varying degrees of disability. In severe cases, the muscle responsible for breathing can be affected, necessitating mechanical ventilation. Understanding Guillain-Barré syndrome is crucial for health professionals as early recognition and treatment can significantly impact patient outcomes. Although the exact cause of Guillain-Barré syndrome remains unknown, ongoing research continues to shed light on the mechanism behind this autoimmune attack and aims to improve diagnosis, treatment, and prevention strategies. Coming to the types of Guillain-Barré syndrome, first type is acute inflammatory demyelinating polyradiculoneuropathy AIDP. It is the most common form of Guillain-Barré syndrome in United States and Europe. It is characterized by the involvement of immune system attacking the myelin sheath of peripheral nerves, muscle weakness starting in the lower limbs and ascend upward with possible involvement of cranial nerves. Second type is Miller-Fisher syndrome MFS. It is a rare variant of GBS that primarily affect cranial nerves. It is characterized by a triad of symptoms: ophthalmoplegia, that is weakness or paralysis of the eye muscles; ataxia, loss of muscle coordination; and areflexia, absence of reflexes. Third type is acute motor neuronal neuropathy AMAN. It is more common in Asia including India, particularly in China and Japan. Characteristics involves the immune system attacking the axons of motor nerves without affecting the myelin sheath. Symptoms are rapid onset of muscle weakness, typically without sensory loss. Reflexes may be preserved or reduced. And last type is acute motor sensory axonal neuropathy AMSAN. It is a severe form of Guillain-Barré syndrome that affects both motor and sensory nerves. It involves direct damage to the axons of both motor and sensory nerves. Symptoms include significant muscle weakness and sensory impairment. It has more prolonged course and can result in substantial disability. Pathophysiology of Guillain-Barré syndrome is complex and it involves an autoimmune response where the body immune system mistakenly targets the peripheral nerves. We will discuss step-by-step explanation of the process. First, it starts with the triggering events. Guillain-Barré syndrome is often preceded by an infection, as we talked earlier. It can be respiratory, gastrointestinal, or viral illness, or bacterial infections such as Campylobacter jejuni. In some cases, Guillain-Barré syndrome can occur after vaccination or surgical procedure. These are the triggering factors. Second is immune activation. These triggering factors lead to the activation of immune system. The immune response is intended to fight off the infection, but instead mistakenly target the peripheral nerves. Third is autoimmune attack. The immune system produces antibodies that cross-react with the components of the peripheral nerves. In AIDP, the primary target is myelin sheath, the protective covering of nerve fibers. In AMAN and AMSAN, the immune system directly attacks the axons, that is nerve fibers themselves. Fourth step is inflammation and demyelination. In AIDP, the immune attack leads to inflammation and demyelination, which disrupt the transmission of nerve signals. The loss of myelin slows down and blocks the conduction of electrical impulse along the nerves, which result in muscle weakness and sensory disturbance. Fifth step is axonal damage. It occurs in AMN and AMSAN. The direct attack on the axons leads to damage and degeneration of nerve fibers, which result in more severe and prolonged symptoms, as the recovery of axonal damage is slower and less predictable than remyelination. Then, stage of clinical manifestations. Because of disruption of nerve signaling leads to the characteristic symptoms of Guillain-Barré syndrome, including tingling, muscle weakness, and paralysis. The severity and progression of symptoms can vary depending on the type of Guillain-Barré syndrome, as we discussed earlier, and the extent of the nerve damage. Last phase is recovery phase. Recovery process involves the resolution of inflammation and, in case of demyelination, the regeneration of myelin sheath. Physical therapy and supportive care are crucial in helping the patient to regain strength and the function. Sign and symptoms of Guillain-Barré syndrome. Coming with initial symptoms, the onset of Guillain-Barré syndrome is often sudden and can progress rapidly over few days to weeks. Early symptoms typically include tingling sensation, that is paresthesias, and weakness that begin in the lower extremities, that is legs and feet. Patient may describe these sensations as pins and needles or numbness. Second is muscle weakness. The hallmark symptom of Guillain-Barré syndrome is progressive muscle weakness. Weakness usually starts in the legs and ascend to the upper body and arms following an ascending pattern. As the weakness progresses, it can affect the muscle involved in the breathing, swallowing, and facial movements. Third, sign symptoms include the reflexes. A significant feature of Guillain-Barré syndrome is loss or reduction of deep tendon reflexes, areflexia or hyporeflexia. Reflexes that are commonly tested include the knee jerk and ankle jerk reflexes, which may be diminished or absent in Guillain-Barré patients. Fourth is sensory disturbances. In addition to muscle weakness, patients may experience sensory disturbances such as numbness or tingling in the hands, feet, or extremities, loss of proprioception, that is ability to sense the position of own body parts, pain which can be severe and cramp-like, affecting the back, arms, and legs. Fifth is cranial nerve involvement. Guillain-Barré syndrome can affect the cranial nerves, leading to difficulty with facial movements such as smiling, chewing, closing the eyes. Can cause double vision, that is diplopia, or difficulty in eye movements, difficulty in swallowing, difficulty in speaking. Sixth is autonomic dysfunction. The autonomic nervous system, which control the involuntary bodily functions, can also be affected in Guillain-Barré syndrome. Symptoms of autonomic dysfunction may include fluctuations in the blood pressure, that is hypertension or hypotension, irregular heart rhythms, arrhythmia, abnormal sweating, gastrointestinal issues such as constipation or difficulty in urinating. Seventh is respiratory involvement. In severe cases, Guillain-Barré syndrome can lead to respiratory muscle weaknesses necessitating the mechanical ventilation. Patient may experience shortness of breath and difficulty breathing. Eighth one is progression and plateau phase. The progression of symptoms usually reaches its peak within 2 to 4 weeks of onset. After the initial progression, patient may enter a plateau phase where symptoms stabilize before gradual improving during the recovery phase. And last is recovery. Recovery phase, as we talked earlier, recovery phase can last several months to years depending on the severity of condition. Most patients experience significant improvement, though some may have residual weakness or sensory disturbances. Coming to the diagnosis, the first step in diagnosing the Guillain-Barré syndrome is obtaining a thorough patient history, which include asking about the recent infections such as respiratory, gastrointestinal infection, vaccination, surgeries, and other potential triggering events which we talked earlier. The clinician should inquire about the onset and progression of symptoms such as muscle weakness, tingling, and sensory disturbances when they start and how they progress. Second is physical examination. During the physical examination, we should assess the muscle strength, reflexes, and sensory functions. Key findings which suggest Guillain-Barré syndrome include symmetrical muscle weakness, often starting in lower limbs and ascending type, diminished or absent reflexes, areflexia, and sensory abnormalities. Diagnostic tests are: first one is nerve conduction studies, NCS. Nerve conduction studies are used to measure the speed and strength of electrical signals as they travel through the peripheral nerves. In Guillain-Barré syndrome, nerve conduction studies typically reveal slow conduction velocity, prolonged distal latency, and evidence of demyelination or axonal damage, depending on the type of Guillain-Barré syndrome. Second is electromyography, EMG. Electromyography is a test which assesses the electrical activity of muscle. EMG can help differentiate between nerve and muscle disorders, and provide additional information about the extent of nerve involvement in Guillain-Barré syndrome. Third one is lumbar puncture spinal tap. A lumbar puncture is performed to collect CSF for analysis. One of the characteristic findings in Guillain-Barré syndrome is elevated protein levels in CSF without a significant increase in lymphocytes, a condition known as albuminocytologic dissociation. This increase in protein reflects the inflammation and damage to peripheral nerves. Other tests includes blood test, which may be conducted to rule out other conditions which can mimic Guillain-Barré syndrome, such as infection, metabolic disorder, and autoimmune diseases. Imaging studies such as magnetic resonance imaging MRI are not typically required for diagnosing GBS but may be used to rule out other potential causes of patient symptoms. Differential diagnosis: we must also consider and rule out other potential causes of the patient symptoms such as chronic inflammatory demyelinating polyneuropathy CIDP or myasthenia gravis, Lyme's disease, and spinal cord disorder. The pattern of symptom progression, clinical findings, and result of diagnostic tests help distinguish Guillain-Barré syndrome from these other conditions. In conclusion, early and accurate diagnosis of Guillain-Barré syndrome is crucial for initiating appropriate treatment and improving patient outcomes. The combination of evaluation, nerve conduction studies, electromyography, and lumbar puncture provides a comprehensive approach to diagnose this complex neurological disorder. Coming to management of Guillain-Barré syndrome, first one is hospitalization. Due to the potential for rapid progression and life-threatening complication, Guillain-Barré syndrome patients are typically hospitalized for close monitoring and supportive care. Patient may require admission to intensive care unit if there is significant respiratory involvement or autonomic dysfunction. Second is immunotherapy. Intravenous immunoglobulins involves infusing antibodies from healthy donor to patient bloodstream. It is believed that it is to help modulate the immune response and reduce the attack on the peripheral nerves. IVIG is administered over several days and often well tolerated by the patients. In the immunotherapy, second is plasmapheresis or plasma exchange. Plasmapheresis is a procedure that removes the patient plasma which contain harmful antibodies and replace it with donor plasma or a plasma substitute. This helps to reduce the levels of antibodies that are attacking the nerves. Plasmapheresis is typically performed over several sessions. Third one is respiratory support. In cases where Guillain-Barré syndrome affects the muscle responsible for breathing, respiratory support is crucial. Patient may require mechanical ventilation if they experience respiratory failure. Regular monitoring of respiratory function, including vital capacity and blood gases, is essential. Fourth is pain management. Pain is a common symptom of Guillain-Barré syndrome and can be severe. Pain management may include medications such as non-steroidal anti-inflammatory drugs, gabapentin, or opioids. Physical therapy and other non-pharmacological intervention can also help to relieve the pain. Physical and occupational therapy rehabilitation is a critical component of Guillain-Barré syndrome management. Physical therapy focuses on the improving muscle strength, coordination, and mobility. It helps patients regain their functional abilities and prevent complications such as contractures. Occupational therapy helps the patient with activities of daily living and aids in adapting a long-term physical limitations. Supportive care involves addressing various components and complications with GBS. Monitoring and managing autonomic dysfunction, including blood pressure fluctuations, heart rate abnormalities, and gastrointestinal issue. Providing nutritional support, especially in the patient who has difficulty in swallowing. Psychological support. The sudden onset and potential severity of GBS can be psychologically distressing for patients and their families. Psychological support, including counseling and mental health services, is important to help patients to cope with the emotional impact of the condition. Regular follow-up with your doctor is essential to monitor recovery and address any residual symptoms. Some patients may experience long-term effects such as muscle weakness or sensory disturbances and may require ongoing rehabilitation. The prognosis of Guillain-Barré syndrome varies depending on the severity of condition and timeliness of treatment. Most patients experience significant improvement with appropriate treatment, but the recovery process can take several months to years. Early and aggressive management of symptoms and complications is key to improving outcomes. Prevention of Guillain-Barré syndrome. First one is Maintain good hygiene. Hand hygiene. Wash your hands frequently with soap and water, especially after using the restroom, before eating, and after coming to contact with potentially contaminated surface. Avoid close contact. Try to avoid close contact with individuals who are sick, especially those with respiratory or gastrointestinal infections. Second is safe food practices. Proper food handling. Ensure that food is cooked thoroughly, especially poultry, and undercooked poultry can be source of Campylobacter jejuni, which is a common trigger for Guillain-Barré syndrome. Avoid raw and undercooked food. Be cautious with raw fruits and vegetables and avoid consuming unpasteurized dairy products. Third is vaccinations. Stay updated. Keep up with recommended vaccinations, including the flu shot and other vaccines that can prevent infection known to trigger Guillain-Barré syndrome, such as influenza, Epstein-Barr virus, and COVID-19. Fourth one is clean water. Ensure access to clean and safe drinking water. Avoid drinking water from sources that may be contaminated. Maintain proper sanitation practices to reduce the risk of waterborne infection. Fifth one is prompt medical attention. Seek medical attention promptly if you experience symptoms such as unexplained weakness, tingling, or numbness. Early diagnosis and treatment can help manage the condition effectively. Sixth is environmental awareness. Be cautious in areas with poor sanitation or known outbreak of infection that can trigger Guillain-Barré syndrome. Take necessary precautions when traveling to areas with poor sanitation or known infectious disease outbreak. So this was all about the Guillain-Barré syndrome. If you like the video, then share and subscribe to our channel Medical Guruji for more updated information regarding many health conditions. Thank you.